start recording, and we should be all good to go. So for anyone that is joining, I'll just ask you to stay on mute until you either have a question or you are speaking at the time, just so that way when we actually are on speaker view, then you can actually look at the person speaking rather than a person who's just got background noise. Thanks everyone for joining for Stay in Your Lane. This actually came about from a conversation Clint and I had from a post he put on Instagram, and we've been able to get some awesome people involved. So just so we can get a little bit of background on everyone, just a real brief description if we can start. Cam, can you give us a brief description about who you are, what your industry is, and where you're working at the moment?
Okay, so my name's Cameron. I'm a physiotherapist, focusing on sports physio and sort of predominantly athlete rehab and return to sport. And previously worked with Manly Sea Eagles in the NRL for 2 years, and currently with Rugby Australia in a rehab role across the men's and women's sevens program.
Nice. And Richard, would you like to tell us a little bit about what you do?
Sure. Richard Fryer, I'm a psychologist and I'm working in a range of roles. So I'm the national psych lead for Archery Australia, the team psychologist for Sunshine Coast Lightning Netball. I got a range of squads with the Queensland Academy of Sport, and do a consulting role with the Australian Institute of Sport.
Brilliant. That's awesome. And we'll move on to Peta.
Yep, I'm a sports dietitian and dietitian, currently being mum, but also working with Manly Sea Eagles. Australian Rugby Sevens is a bit of a downtime at the moment. New South Wales Rugby League, I'm pretty sure I'm forgetting someone. But yeah, a few teams, and also just in private practice, and I've been around for a little while.
Perfect. And Nick?
Yeah, so I'm Nicolai. I'm originally from Australia and over in New Zealand at the moment. I'm just about to finish up a role with New Zealand Rowing as the assistant to the elites and the lead of the 23s and junior pathways. And I'm about to go into a role up in Auckland as the lead strength and conditioning coach of the Black Sticks women's hockey team. And before that, I was working at Sydney Uni across various teams and across women's state of origin as well.
Awesome. And last but not least, Clint.
Yeah, thanks, buddy. Clinton Hill, strength and conditioning coach, currently working with Motorcycle New South Wales and a series of individual athletes, some in the Ironman series and right through to a couple of Olympians in rowing and a few other sports as well. I guess the biggest part of today for me is certainly to address some things that Kurt and I have spoken about over the years, but more specifically, everyone involved today has some experiences to bounce off each other about staying in their own lane around what's going to occur over the coming years and whatever else as we unfold into the next stage of things. But I guess for me, the most important part of this is knowing how to work together well and knowing where to find your niche, but also knowing how to work with and choose the right individuals for yourself.
All right, and that kind of leads on to our actual first question. And so we're going to start in the same order I just introduced everyone in. Is what does stay in your lane mean to you? So we'll start with Cam.
Thanks, Kurt. I suppose similar to what Clint just said, staying in your lane for me, like as a physiotherapist practicing in rehab space, is about fulfilling your role is to the best of your knowledge, your ability, but then also using the other health professionals to create a team around the athlete in a patient-centered model where the patient sits at the center of it, and you're trying to do your best for that particular patient. And I sort of think of the analogy, if you had a pie and you're splitting the pie up into different pieces, they're the different allied health professionals or medical professionals that could potentially contribute to the patient's outcome. You need to fulfill your piece of the pie as best as you can while creating awareness, knowledge, and creating opportunity for other health professionals to create the whole pie together. So that's probably, what it means to me: fulfilling your role to the best of your ability, creating an environment where you can allow other people to contribute to the athlete's success, but in a patient-centered model.
I love it. Nice and simple as well. We don't need to overcomplicate it, so I love it. Let's move on to Richard. What do you think?
Yeah, I disagree with all of that. No, just kidding. I agree with all of that. I probably build on it as well to introduce the idea of competence and really knowing yourself and understanding the kind of areas of competence that you have. And I think that's both a within profession competence. Certainly as a psychologist, there's such a breadth of skill areas that you could specialize in or understand about. And I think there's an element of really understanding when there's a need to bring in somebody else because you've reached the edges of your own ability. So somebody else within the profession, and then also knowing when it's more appropriate to bring in somebody from outside of the profession. And I think this idea of staying in your lane, I kind of always wonder whether, are we thinking about a swimming analogy of the real kind of solid lane boundaries, or are we thinking more of athletics where you can kind of deviate across boundaries? And so I don't want to see this as a really fixed limitation, but really building a skill, which is a skill I believe in its own right, of understanding what my own competency is and where the limits of that is, and when should I be really thinking about bringing somebody else into the mix.
Fantastic. Peter.
Yeah, I like the wording that you use there, Richard. And I think staying in your lane within my profession is very much also knowing where my specialty lies, because in dietetics you can work across a lot of different comorbidities and areas. And so it comes with experience that if I'm referred an allergy patient, then I will confidently say, I cannot see you, sorry, that is not my area of expertise, and refer on. And staying in your lane to me is actually, I think it gets blurred because as we gain experience and when you work in a team environment, you actually do talk to the other professionals a lot. You've got to be really careful that you're very confident in the fact that you are giving the client and person in front of you your information based on your expertise, not on any form of opinion of what. And when we bring in our own opinion, I think that's when we kind of start merging into other people's lanes and areas. So if you just keep on thinking, I'm going to provide messages around my area of expertise, you can usually stay in your lane quite well.
Yeah, I absolutely love that, and talking about the difference between opinion and fact there. So moving on to Nick.
I'm gonna throw a big spanner in the works, and I feel like with stay in your lane, it can be interpreted in different ways, especially in differences between working with teams and working in private. In working in private, it's often taken as scope of practice, which I fully agree with. You should absolutely stick to your scope of practice, stay with what you actually are able to educate and share. However, in my practice, I look at stay in your lane as working in silos, which is really problematic. For me, I think you need to actually have some merging so you get that collaboration and that knowledge sharing. So that's kind of how I see it, but that's my interpretation anyway.
No, and it's good to have different views on this, and that's why today is going to be a great discussion. Clint?
Look, I guess the you know, and to give everyone a little background, the stay in the lane idea, you know, that it might be a catch cry or a title piece here, but what in I think a lot of cases gets confused is that as a strength and conditioning coach, for example, and I'll use Richard and Peta as nice easy examples here. So someone will come to me and ask a question about something to do with their mental health or their mental preparation or whatever else. Now, if I'm in an environment where I don't have access to someone like Richard, it's my job firstly to find a way to give them as much information as I can without overstepping the line, without overstepping the mark. And the same, I'll use Pete as another example here. I refer a lot of clients to Pete, and the reason behind that is that I know where my lane finishes when it comes to nutrition. I might tell someone, you know, yeah, sure, you can take you know, a protein powder after your training session, but I'm not going to tell them specific amounts. That's Pete's area, right? So it's a little bit of understanding around, you know, a little like Nick said, that the lanes can blend together a little bit, but it's about understanding for me that realistically, as an S&C, my role is lift weights, run faster, you know, work better as a team unit. I'm not here to diagnose any psychological problems, although I'll be very clear to acknowledge that if you're a professional athlete, you're probably right up there with the best of them with psychological problems. But I think understanding that everyone on this panel to start with, we're here because we know where our lane is, but we also try to be very mindful around understanding that we can merge a little bit as long as we have the support of the people around you. You know, if I know that I need Pete, I can ring her. If I know I need Richard, I can ring Cam, etc. You know, it's not something that yes, you know, we want to focus on these things, but I guess for me, it's about understanding your role, knowing where you lie as a professional and your expertise, and understanding that in some cases it's okay to merge into someone else's lane as long as you've got support of the people around you, and you don't take it too far.
Can I jump in there, Kurt, just because I really like what you said there, Clint, because what for me is what I heard you saying without saying it was you're always asking yourself where is the right time and point to pass this on. That doesn't mean that you'll never say anything. It doesn't mean that you won't. You know, there's a lot of stuff out there about the value of things like mental health first aid.
Yes.
As a way of educating people in sometimes walking away and referring without doing anything is the wrong thing to do at that point in time.
Yeah.
So knowing that and asking yourself, you know, what are the risks of carrying on and what's the point for referral, or does it cause more damage to say, hey, that's not something I should do right now, and passing it on, and just asking yourself the question, I think, is a valuable thing to do.
Yeah, and I think, Richard, just on that too, also, look, and Pete and I have spoken about this in depth, and with Nick as well at last year's ASCA conference. Some parts of this also come down to where you lie in the spectrum of experience in your role. If you've been a strength and conditioning coach or a psychologist or a psychiatrist for 1 year, you're going to have a very different opinion piece to when you're 25 years down the path, right? And if I've been working with Pete for the last 7-8 years, I can start to gauge some of the responses that she's going to have. So based on those kind of things, it's understanding where you sit, and I'm going to call it the pecking order, but just so that I can explain myself a little better, So if you come in at that first level, I really think you should be controlling some of your opinions and really looking to sit down with, Cam around a shoulder issue and learn what the spectrum is and say, rightio, okay, well, I feel confident that in year one, I can teach someone how to do, a particular shoulder rehab style exercise. But by year 10 of being in that role, I should have a much better understanding, because every year I should have added a layer to my experience and expertise. So I think, again, that there is some grey areas there, but understanding that I'm never going to diagnose some hormonal problem for Pete. That'd be ridiculous. Me trying to read a blood work panel and feed someone some type of clay solution or something along those
Hey,
lines.
hey, I did not feed anyone clay.
Oh,
Eastern suburbs person.
I want to be very clear that I'm not talking about Peter Carige in this particular instance, but let's not point too many fingers, shall I, Pete? But look, I'll leave that comment there and let you get to the second question there, Kurt.
That's great. I think that that brings up a few different points, obviously, and outside of the questions or potentially asked today. But I guess on that topic a little bit, so it's kind of a joint question. Is one, what other coaches or professionals do you work with in an athlete's team? And two, how do you support those other coaches or professionals? And it is a big, broad question. So, like as an S&C, we'd obviously work with physios, psychologists, dietitians, other coaches. So do you work with the same type of people, or is it any, say, just working with a coach or just working with the athlete, etc.? And how do you support them? And we're going to start with you again, Cam.
Okay, so I suppose there's a big distinction between working in professional sport with athletes, where they have access to like several health professionals, allied health and medical staff, and then private practice, where you tend to work more in a silo, whether you're a sole practitioner or you work in a bigger private practice, but still you tend to not be exposed to the same extent to other health professionals. So I'll focus my answer more on the private practice. So as a physio, the most common referral pathways that I have are to the sports physician, the orthopedic surgeon, and the GP. So we're focusing mainly on sports and musculoskeletal injuries. And all of those referrals are facilitated with a letter, and a letter that's sort of understood by the patient and given to the patient, and then also sent ahead of time to the specialist that I'm referring to. And if needed, within my referral network and the people that I know and trust to work with my patients, they're the people that you can trust to pick up the phone and just have a quick conversation, and they're the type of people that are happy to do that for the patient. And that's probably the most professional and the most streamlined approach that I've found. You know, a letter that's taken with the patient, and then a phone call informally, either pre or post the consultation with the health professional.
And before I ask Richard the same question, in regards to that, Cam, are there any times, say, with the physician or surgeon, you may disagree with them? And how do you kind of deal with a situation like that?
Yeah, good question. So there have been instances of that, but it's, I suppose, they're few and far between. And if I'm referring to someone that has more experience about a particular topic or issue than me, that's the reason why I'm referring to them. So I trust their judgment on that issue, even if it may be something that has conflicted or contrasted with my point of view. They're the expert in that field, and I trust their judgment and support the patient through the decision making.
Brilliant. No, that's exactly what you need to do. Keep it simple, right? So Richard, same question as earlier.
Yeah, probably along a similar line. It depends a little bit on which sport, depends a bit on which program. The kinds of people I'll be dealing with would be, you know, everybody that's represented on this panel, plus sports doctors, potentially GPs, and also parents. A lot of work that I do is with parents, particularly with youth athletes, and probably the kind of the greatest area of connection that I find, aside from working directly with athletes, is usually a critical element is the relationship with the coach. And that's harder in individual sports, or where I might not have a direct relationship with the coach, but I have to go out of my way to try and build one, because without that, it tends to be a less effective relationship. And then also, for whatever reason, I find myself working pretty much daily with dietitians, particularly around disordered eating, and looking at, there's a diet aspect to that, and then there's also obviously a psychological aspect to that. And working together, I find, is obviously a much more beneficial outcome for individuals than working in isolation for one another. So those are probably the kind of key areas that I work on, and a lot of the ways that I attempt to navigate that daily is through face-to-face, through meetings and through conversations, rather than Some of what I do inevitably is through letters and the written form, but most of it's face-to-face and discussion-based medical meetings.
Okay, brilliant. And just as an example to throw you another question, that one, Richard, as well, is say the different dealings between say working with youth or working with say a team such as the Sunshine Coast Lightning. Like, what are the biggest differences there that you find in regards to the communication between professionals or parents?
Yeah, I mean, obviously the role involvement of the parents in the conversation is critical, and the type of work that we do, obviously with younger athletes, the kind of concepts are a little bit more simplified, and more experiential, more hands-on. But actually, you know, maybe it's recently I've been more surprised by how sophisticated some of the younger athletes are and how much they're paying attention to psychology in their development much earlier than maybe they would have been 10 or 15 years ago. So I see that as a good thing. So more similarities actually nowadays than differences.
Oh, that's really great to hear. Peter.
Yeah, look, I refer to S&Cs, physios, sports doctors, psychs a lot, especially in private practice. The way I refer now versus I suppose when I started is it's probably a bit more personal because I've got my network around me of people that I do use quite frequently. So it's more a text or an email or a quick chat. I think it's really important that it is very different in private practice to team settings. In team settings, you do try and actually catch up in person wherever you can. And that in itself has a lot of limitations with different teams. Some teams, you know, are time poor, so you won't actually get face-to-face. At Manly, I'm lucky that I work closely with the rehab and S&C guy there. And so we always just have, you know, quick chats after I'm in. But then sometimes too, I find in teams, if you think private practice is difficult, teams, sometimes there can be a hierarchy or a process in place that you can't control. So communication can actually be, even though you're working with the people every day, it can actually be more complicated. And then also I'm in mostly male-dominated teams, I find they're quite behind in engaging sports psychs, whereas they're people that, as Richard has mentioned, I rely on quite heavily normally as a dietitian. So there still can be barriers in a team setting depending on the funding and depending on the personnel you're working with. And then also depending how proactive they are in actually having meetings and having medical meetings. And to be honest, some of the national teams I have worked with don't even invite the dietitian to the medical meetings when we do overlap quite a lot. So sometimes it's actually very difficult for me to get the information in team settings versus private practice, which has been, I think, a steep learning curve for me, because initially, I suppose, in my initial team experiences, it was very good communication, but it's not always the case.
Yeah, nice. It's another challenge to face in itself. And I'll ask another question here of you, Peter. So if you don't get, say, invited to those, I guess, specific meetings, how do you go about then dealing with the athletes in that situation?
So unfortunately, in those situations, well, two ways. Luckily, I had established good relationships with the physios. So the physios would keep me updated. So I'd go directly to them to find out the injuries, or I would backdoor it even more and set up SmarterBase alerts. So I was getting alerted to injuries through SmarterBase. So I basically made sure that I would find out. And then the less desirable way is when you're made to feel like an idiot when the athlete has to tell you or do the, oh, didn't you know I've got a fracture here situation. So you obviously try and prevent that at any case, because it makes you look bad, but also makes the whole team look bad. So, and that's where experience comes into play, because you've got to learn to figure out other ways to find the information so you can do your job well to a standard that you're happy with, and not be limited by maybe the less experienced staff around you.
Oh, awesome. Great response.
Not that I'm recommending that.
No. But
you've got to work with the restraints put on you. And also as a dietitian, I'm sure Richard would find, we're not in there every day. So you've got limited time. So you've got to kind of get in, make sure you've got all the information to do your job and then get out. So you've got to learn to work the system quite well.
So as I was listening to Peter talking then, it's almost like, you know, we got the name of this talk being stay in your lane. And I think there is still an element of stay in your lane being used as a directive from other people, like you should stay in your lane as a way of, it's almost like through insecurity or defensiveness or a sense of, you know, still the element of power around information that results in people being outside of some of these meetings where they really should be in them. And I think there's still work to be done on kind of making that more inclusive and involving people more.
I think that was almost what I was trying to allude to in my explanation of stay in your lane. I think the difference between stay in your lane and scope of practice, especially in a team environment, is really important. We need to make sure that in that team environment, it's a really collaborative experience.
Yeah, absolutely. That's a great point, Nick. And before we move on to you, and in regards to what Pete was saying before, and I think we've all probably experienced this at some point, is there's a certain level of, for a lack of a better word, manipulation around getting the information that you require because somebody in that situation hasn't provided the most effective communication or method of communication required. And so I think we've probably all experienced something like that at some point. Now, so on to you, Nick. So same question as before. If you need me to repeat it, I can.
No, you're all good. So in a team environment where we are really trying to improve our collaboration, so we have weekly meetings that we go over any challenges or any new issues with any of our athletes. So those meetings are just athlete performance services. So it doesn't include the coaches, but they are clued into all of it from the most important person, depending on the issue. So if it's a medical issue, it will come from the doctors or the physios. So it's basically streamlining our communication processes. But in those meetings, we have, and I'm sure I'm going to forget one, but we have our strength and conditioning coaches, our dietetics, we have our performance science, which is our physiology and our biomech. We have our athlete life, so our basically wellness services is basically what athlete life is, wellness, and also career and progression. Everyone has different names for it. We have our medical and we have our physios. Again, if I haven't said, we also have psych, if I haven't said that one. So we have a wide range of different ideas and different people in the room to share any views that they have. So if someone is having an issue with, for example, an injury, and that injury may have come through something like energy availability, that's coming from medical, it's coming from physio, it's coming from psych, it's coming from dietetics. S&C is knowing where they can progress, then athlete life knows. So if they may have extra time because they won't be doing the full training load, they can give them extra, extra uni subjects or maybe some work experience, and basically aligns everyone together. So that's in a team environment, that's a really good way of doing it, in my experience anyway.
Okay, yeah, nice. I don't think I have any more questions for you at the moment, so we'll move on to Clint for this one.
Look, I guess first thing there, guys, is that, you know, we've all been in situations where we've had to deal with, you know, a difficult coach, a difficult team manager, difficult, you know, whatever it happens to be, and whether that's through ego, whether that's through, you know, that person's lack of experience. But I guess the thing that I really wanted to add to this little piece here is that over the years, I've had to play part of each role, right? Like, and it might be, and using the psych side of things, you know, an athlete might be more comfortable to come to me about something before they go to a coach, right? Because they might come to me and say, you know, let's say in injury stakes, you know, look, I'm having a little bit of trouble with my left calf, you know, I don't want the coach to know because he won't pick me next week. Now, the hard part about that is where where I as a, let's use the term now, semi-mature strength and conditioning, maybe not mentally mature in any way, shape or form, but been in the game long enough to throw myself into the mature level. You know, I would go to the physio privately if I had that good relationship and go, hey, look, ex-athlete's starting to struggle here. You know, I want to do this. I need to pull him out of this, blah, blah, blah. Now, the concept that I guess I'm trying to, you know, get people to understand is that's not me crossing over into, you know, Cam's lane, into the physio's lane. That's me understanding that person, you know, has the trust in me to do that. But I've also still got to make a decision whether I think that is the right decision for the athlete in the long term. Now, I guess where I'm sort of going with this for everyone that's watching today and if they're listening as well, is that staying in your lane is not just about knowing what you must do. It's about knowing what each of the other individuals that you have access to can do for you, having a good enough relationship with each of them and being able to merge that together where you can. Because, you know, and we're all going to have this as an experience at certain points in our life, that the physio that you're working with, you know, would pull that person straight out and they'd lose that spot in the team. And maybe that's not, you know, always the best decision straight off the bat. Maybe there's a little bit of give and take there to earn that trust off the athlete, give them a little bit of an extra opportunity to get through that. Now, I'm also not saying that you should be lying to your coaches and lying to your S&C, your physio and whoever else is around you. But what I think should occur is this should be a really collaborative deal where everyone is trying to get the best team on the park, mentally healthy, physically well, you know, emotionally, and I guess also, you know, nutritionally, you know, sound. It's about understanding that there should be a solid collaboration across all parts. And I know, look, I'm going to give Nick a real solid rap here. I know that, you know, at Sydney Uni, Nick had such a great group of athletes that had such a high respect for her that she was able to probably play a little bit of each role at certain times. And I know for a fact she never crossed over that line. And I think it's a big feather in someone like Nick's cap to be able to know where that line is and how to play it well. So yeah.
Sorry if I can, just a question for Clint there. Say if the athlete does confide with you that their calf's tight and that they don't want to necessarily progress to an assessment with the physio or mention it to the doc or the coach, if you then make the decision, okay, well, you know, I'll look after you in this session and, you know, I'll keep an eye on you, and then it does progress to a strain, who takes responsibility for the injury there in your point of view?
Yeah, look, Cam, I reckon that's an excellent question. And I'll be honest with you, I was really hoping that someone was going to push me on that. So thank you for doing that, because I think it's important to acknowledge this part. And hand on heart, I've made this mistake. So, you know, I'm not going to tell you that I'm this perfect S&C that's never been at fault here. I've been both ways. I've taken that athlete and thought, you know what, look, I think I can guide him through this session and maybe, you know, get him to do a little bit of extra skill work rather than that running block or whatever the case may be. And their calf has gone in the game or something. And I'm just using that as an example. It's not a direct example. I'm just trying to, you know, run with the original analogy, the original example. But I genuinely believe if you make that choice, you've got to own it. You've got to step up and show responsibility. And that is definitely a risk, mate. And I think when I look at that, you know, I think as I've gotten older, I've made sure, and Pete alluded to this earlier, the better your relationship is with each of those individuals. If Cam, if you and I were working together for a team, you know, I'd make sure my relationship with you was tight, so that if I made that decision, you would probably back me and saying, hey, you know what, look, 9 times out of 10, I would have backed Clint's decision on that. You know, if he thought that was the case, that's a point there. But I genuinely think, if someone was hobbling around and couldn't put full weight on their calf, there's definitely a little element there where I would have gone, well, mate, that's not happening. I've got to refer this to the physio because that's the case. But I may have done something, and again, just using a nice simple one, I might have done a knee to wall test and gone, okay, well, hang on. My idea here is if their knee to wall is equal to what it was previously, because I would have had those records as an S&C, then I would be able to turn around and go, well, hang on, maybe this is, let's have a little look at this first. Let's give you a little session off or whatever the case may be and try and work that through. Have I answered that well enough for you, mate?
Yeah, I think it's a great example that you raised because it's an example of something that happens, day to day. It's something that you might think, oh, it's not too much of a big deal, but it's actually hits at the core of what we're discussing today in terms of staying in your lane. Like you said, developing trust with your other professionals that you can have a conversation. For me as a physio, I'm making decisions about return to play, athlete availability and things like that. I think it helps to use a shared decision-making model. And I think the more people that you involve in the decision-making, the less weight it puts on your shoulders as a practitioner. But I understand what you're saying. If the athletes trust and, there's no, when we say stay in your lane, it's not a defined point. Sometimes it can be very blurry and there's times where you have to take your interpretation of that. So
yeah,
it's a good example.
I think just on that as well, like, we talk about the fact that, it's a black and white, decision whether someone makes the field that particular game. Well, if you talk about, and Pete's obviously, Pete works with the New South Wales Origin team, right? So let's just use that as a nice simple example. If we're talking, they've got 3 games a year, and the level of how much they'll let someone get away with training that week to make the field is a very big difference, as opposed to, we're playing round 3, Manly are playing. I'll use the Broncos as an example for all you shitty little Queenslanders, pardon that. But, I think it's nice and easy to say, well, we're going to roll the Broncos by 50. So we're not going to put our star player in who may or may not have a minor calf strain. So I think sometimes too, it's not just about staying in your lane around your role. It may also be to do with the game as well, and the particular point of the season, if you will. So maybe that adds another little aspect to it as well.
So can I just come back to the original point? I think one of the reasons for me why this issue of scope of practice and staying within that scope of practice is tough is because there's an element of ego that comes into this when we're the person where, somebody comes to us and they go, oh, geez, they've come to us with these questions about all this stuff. They must really trust me and they must really value my opinion. And I think that becomes the real easy point then to kind of go beyond where it might be helpful. And then Cam is just saying, there can be some things that happen as a consequence. And so it's almost a positive that said we built this really great relationship. And because of that, they come to us. And it's really hard then to go, it's great that you've come to me, but maybe that question's best answered by the coach or the physio or someone. Is there a reason why you've come to me and you haven't gone to them? And really, being willing to have that conversation as well.
I think that's a really, really important point. I've seen athletes numerous times in all different environments try and play off different coaches, coach and support staff, whatever. And it's really, really essential that we have those good relationships with the staff we're working with and understanding that the athletes, some of them, they will try and do that. And if they are, like Richard said, really questioning them around it. And if it is a really, we'll use Cam's example, if it's something where the athlete's got a niggly calf and they don't want to tell people, they don't want to get fully assessed because they think it's going to affect their selection or something, there's no harm in just going to the physio and having a quiet word and saying, hey, I'm not super comfortable with their calf. They've told me this. What do you think? It doesn't necessarily mean the physio is going to take them then and there and do an assessment. But if the physio knows what the situation is, they may go, hey, well, they've had this, that, the other presenting in clinic. They probably can't do what you're asking them to do. Or, they usually do have a bit of tightness. This will be easily to easily played through or trained through. So having those quiet words and having those good relationships with the staff as well, so that you trust them, that they're not going to be like, oh, hey, Nick just told me that you have niggly calf. I'm going to assess you right in front of the coach. Like, understanding how it all integrates is really important too.
I think they're very valid points to bring up. And from what I've seen as well is, I think a lot of that comes down to that experience. And so if you're a new coach, it's harder to identify those positions that you're in. So like Richard was saying, if you're a new coach, a lot of times the new coaches generally have that bigger ego. They get involved in that. Oh, yes, I'm being trusted. Whereas the more experienced coach will be able to guide that selection across to the right professional at the right time and have those conversations.
I'll just add something on there, Kurt. It's just you have to trust the people that you work with, and unfortunately in sport it's a bit of a revolving door, and so very few people have extended relationships with extended people that they're working with. So even though maybe there's something, this is maybe Richard's expertise, what are we doing wrong as health professionals working in teams that we don't trust each other? Is it that people are being hired that just don't have enough experience, that they don't know what the other professionals can bring to the table? Is it a communication, or is it because in professional sport, everyone's out for themselves and out to create their own name? So I just, from listening to all those comments, and I've been in teams where it's worked well, and I've been in teams more recently that it's worked really poorly at, and it comes down to trust. So maybe that's the next topic, and Richard can lead it.
Yeah, I think that it's a great question, Peter, and I think it's potentially it's certainly a bigger question than today. But if I just offered one thing on it, I think my view is the best teams are the ones that have the most stable support teams. The Broncos have been mentioned already, and I think there's obviously something about when you get the revolving door of staff, it destabilizes. And I also think where there is that turnover in staff in support roles, clubs or teams or environments don't always spend the time to invest in developing those relationships, and we expect that trust is going to happen just by chance. And of course, trust happens through shared experience, and if we don't have that shared experience, we've got to build it. And if we haven't built it, then we shouldn't expect people to behave like there's a trusting relationship.
That's a really great point, Richard. So thanks for adding to what Peter was saying there. So like you said, it's a much bigger conversation than today. And so obviously the word trust gets thrown around a lot at the moment. And we've mentioned some of these already, but what are some of the barriers that you do see within this stay in the lane situation? Like I said, we've covered a few already. Like I can already see that essentially that line, that blurred line, can be slightly bigger if you've got more experience than if you're newer to coaching, because you've dealt with a certain professional and you roughly know or have that trust in that situation and in that professional that you can extend a little bit further than where your specific scope of practice is. So we'll again start with Cam here. Outside of what we've already discussed, but also what we have discussed, what barriers do you see in this situation?
Thanks, mate. I think the last sort of conversation we had highlighted a lot of issues around barriers to referrals and interdisciplinary, and even in the medical team in one sport, referring different context and issues. I think that probably ego is as big a one as any. And, the idea that you as a health professional, you're perceived to have a good amount of trust or a high level of trust from that athlete. And being able to recognize that, and when you are acting sort of through ego, even though it might come from a good place, everyone wants to help the athlete or the patient that they're working with, recognize when that does come into your decision making. Trust, I think Richard's points there were outstanding. Like it's hard. You only build trust through learned and shared experience, and that only comes with time. Unfortunately, in sport, it's such a volatile environment at times that you only one bad season or one string of losses away from having a staff turnover. And so it's really not professional sport and high performance environments aren't necessarily the best sort of places to breed trust between your coaching staff and your health professionals, because it is volatile and it has a high staff turnover. So that is maybe one barrier. And then because it is volatile, you tend to try to protect your own turf as much as possible. And then even that, withholding information, or however that break down in terms of staying in your lane and getting the best outcome for the patient.
I think it's a great point Cam makes in regards to the volatility around the professional industry. And I think as an S&C coach, we're all taught early on to make sure you track what you do, to make sure you validate your job to a certain extent as well. So let's move on to Richard.
Yeah, a couple of points I'd make, Kurt, on this. One is, just building on this idea of ego, or the idea of newness to something being an issue. I don't know if you're familiar with this concept of the Dunning-Kruger effect, which is a cognitive bias, which is the idea that when I'm new to something and I learn a little bit about something, my confidence in my ability is massive. And some people call this point Mount Stupid. It's the idea that, I've learned a little bit and suddenly I have this belief inside me that I'm an expert in everything. And then the more I learn about the thing, I realize it's complex, and therefore my confidence drops down significantly. And then eventually I get to some degree of mastery or capability, and my confidence starts to come up, but interestingly, nowhere near where it was originally. And so I think one of the barriers is that the barriers to kind of, sharing is that when people have a little bit of knowledge, and sometimes in my experience, this is fueled, particularly in psychology, it's fueled by overly simplistic messages in the media about the psychology of performance, that then gives people the impression that they know a whole lot about something, whereas in reality, they potentially don't know that much. Or the worst case is they actually know things, or they think they know things, which are actually going to be ineffective or unhelpful to the athlete or the person. So I think that element of understanding how our innate biases as human beings can work against us when it comes to sharing information and create a barrier in and of themselves. And then almost as practitioners saying, yeah, how confident am I that I've got this covered myself? And if the answer is pretty confident, that should be a flag that says I should be talking to somebody about this. Because if I'm really confident, it's potentially a suggestion that I'm being too simplistic around what is actually a complex issue. And then the other thing I'd say is, which is the innate issues around confidentiality, patient confidentiality, that sense of I'm telling you this in confidence, and how do we navigate how much of this do we share with coaches, with other practitioners, so that there's an openness about these issues and the work that we do together, and really navigating that with athletes directly, so that we can get over the idea of confidentiality and becoming a barrier to sharing and talking.
I think they're two very, very valid points. We haven't really discussed too much. I'll be honest, and I think it was only recently with a physio that knows I work with the athletes that they deal with, and they actually came to me and said, "Oh, I can't give you any information without their approval." I was like, "Well," I was a little taken back a bit, because I work with people in the team, and they work with the people in the team as well. And so, yeah, absolutely. Very valid points. Peta?
Richard, I'm totally stealing that term of point of Mount Stupid. Welcome to the nutrition world. Everyone's an expert if they've lost 5 kilos in their lifetime.
It's a super great term.
Oh,
Love
my
it.
goodness. I think nutrition like psych is really tough. I think a lot of people know a little, therefore they think they know a lot. And I think a lot of the team stuff's already been covered, but just taking it a step back to a little bit simpler and in private practice, because I find too, my referral streams are somewhat limited by either people giving incorrect information themselves, or sometimes, especially physios, and not you, Cam, you've been taught well by me, but sometimes people literally aren't confident in how to have those conversations to refer to another professional. So when I am actually doing professional development for physios or for PTs or for S&Cs. I literally break it down that PTs know that giving nutrition advice is outside of their scope, but they go, when a client asks me, I feel obliged to tell them this is what I eat or this is what I think, rather than saying, I don't know, you need to go see Peta. So we actually practice, how are you going to respond to those answers? I can get you fit and strong. However, I can't help you with your weight loss because it is 80% diet. Therefore, if that is your main goal, I would recommend seeing blah, blah, blah. Or with the physios, and I still work with physios, young male physios, once again, not chem, other ones that are too scared to ask about females if they've got amenorrhea or menstruating, and they've clearly got overtraining injuries, yet they're too scared to ask those next steps to therefore lead into a referral. So I try and script it for them, or, they might have a bad knee or a bad hip and they know weight loss will help the person seen in front of them, but they're too scared to suggest weight loss. So I give them avenues to go around that. Like, did you know that, 50% of pain can be reduced by 10% weight loss? Have you looked, so it's sometimes we actually need to simplify it and make sure people actually have the skills to have those conversations to give those simple referrals. Does that make sense? And that's something that they're not taught you're not taught that in university. You're not taught that your first year out. So I think that as allied health, I think we're all lacking those really simple skills.
That absolutely makes sense, Peter. I think it's a great point to make. And working with women myself, I've been lucky in rugby league. They're very open, so you can just tell them. They're like, "Yeah, we'll tell you this," which is great. But there are others, like working with dancers, it's a completely different situation. So being able to navigate and communicate appropriately is massive.
It's not a sign of failure to refer somebody on.
Yeah, look, I
Definitely.
Everyone on this panel knows David Boyle, and I'll give Boyle a rap. And if any of the people who are not on the panel today and are listening, please find out who David Boyle is. Tremendous human being, one of the nicest guys in the strength and conditioning world. But he has a perfect saying that is, I don't know everything, but I know someone who does. Now, he bashed that into me as a first or second year S&C, the first opportunity I had working with him, which was at West Tigers. And, it comes down to, and Richard, everyone's now talked about the Dunning-Kruger effect, which is, again, for those of you who don't know what that is, please Google it, look at the diagram, understand it, because it will explain to you a lot of things. But certainly in this realm, I think one of the key elements is, and Peter sees this probably more than any one of us, as a PT, somebody will do an ISSN or a precision nutrition course, which technically means that they can hand out a diet. And I've seen the pieces of crap that they pump out to those people. And I think it's really interesting because I definitely did those things in my first couple of years as an S&C, and look, obviously I'm trying to be completely honest and open with people so that people can see it's okay to make those mistakes. And I certainly did them off the back of ego, I was a 105 kilo ex-rugby player that thought I knew it all, so I'm certainly here to say to everyone that's involved, that self-awareness piece that comes with experience and comes with, understanding that the people around you are just so amazing if you allow yourself to learn from them. Pete's taught me so much about nutrition. Some of the physios that I've worked with from non-professional sports right through to professional sports have taught me some amazing tricks, techniques, whatever it happens to be. But I think realistically, when we go through all of this, it's staying in your lane is I'm a fully qualified strength and conditioning coach with a double master's degree. I know what I know, and I also know what I don't know. I know nothing about skateboarding. I know nothing about, well, I clearly also don't know too much about jiu-jitsu because I couldn't even step backwards without doing my own knee in. But what I guess I really want to be clear on is that I think when it comes down to this, and Cam talked about this very early as one of the first things he said, he said it's like pieces of a pie. You know, there's 6 of us sitting here on this panel, you know, and we make up that piece of that pie. You know, if one of those pieces gets taken away, that next person that comes into that particular piece, be it a physio or an S&C, may not fit that pie perfectly. So there's another learning curve that goes through all of this, and understanding how that might work and whatever else. So I think it's really important to remember that, especially in the physio and the dietetics world, there's so many things that people think they know because they read a book on, you know, an ancient method, or they saw a diagram on something that, you know, was 15 years ago. Well, research changes minute by minute, and I understand that I don't have enough time to even read all of the strength and conditioning literature that comes out on a daily basis. So I look to these people for guidance, and I trust that they're specialists in their field. I think that's just, you know, common knowledge, but also, you know, being self-aware that I don't want to know. I don't want to know stuff about food. I couldn't give a rat's ass whether something fits into the fat category or the carbohydrate category. So, you know, that's Pete's job. She can deal with that. So I think understanding where you sit in that and where you want to be and what lane you want to be in, you make the choice.
Yeah, and a few great points there, Clint. We're going to continue on in same kind of conversation, because essentially self-awareness becomes a barrier, right? And that's one of those things where you grow from failure. Failing is not a bad thing. So, Nick.
Oh, just checking I wasn't being moved on. So for me, a lot of this comes back to, like Richard said, it's a big issue around trust. So all of us as professionals, we find it hugely important to have trust with our athletes, and we try and gain that as quickly as possible. That's super important. Why don't we then do the same with our support staff and the people we work with? It's exactly the same. We shouldn't just be prioritizing the athletes. It should be a whole team, and which it is. On that as well, I know in S&C, it's an interesting culture where often physios are negatively thought of, or they're given crap at a lot of conferences, and people joke about it. And I'm sure the same happens with physios at times, or any of the professions. We all have our challenges, and I think sometimes it comes down to our KPIs. For example, if you're a physio, you're looking at them being healthy. That's the number one outcome, getting them back on the park or wherever. As an S&C, it's performance. So sometimes that's not always, your goals are conflicting, which is okay. But having that trust, and if you do trust them, you can have those robust discussions and come to a clear outcome where everyone is happy and understands where it should be, rather than people trying to use ego and overstepping and wanting their pathway just because it's theirs. So I think that's really important. So as in each of our industries, we need to stop the giving shit to other professions. It's unprofessional. We should start going, hey, as an S&C, maybe I should look at going to a dietetics seminar or a physio seminar. I could learn something. I'm not going to overstep my scope of practice and step into their lane. But if I know more about why they make that decision, my decisions will line up better. I will understand why they've made it. So I'm not going to have all these challenges, and I'm not going to take it as an attack to my ego. I will take it as oh, cool. That's why you make that decision. That's going to give me better ideas to progress my own practice.
Yeah, very good point. And I think it's something that carries over, not just between professions, but we see it a lot on social media, is the bagging of other people that just don't agree with what we have to say. So it's a very big topic, again, outside of stay in your lane as well. This next question is pretty, I guess, blunt one that can be very broad, but I'll see if you can answer this as concisely as possible. What is stepping over the boundaries in your profession from other professionals? So that, again, it could be a very broad question, but can you answer it as concisely as possible? So we'll start with Cam here. What is stepping over the boundaries in regard to stay in your lane? So Cam?
Yep. So probably the example that I get all the time is personal trainers diagnosing musculoskeletal injuries, and then with the diagnosis that
Hang
they've
on,
come up.
A personal trainer can't diagnose injuries?
Well, no, but then what's really unhelpful after that is the 10 or 12 weeks that the patient goes on to try and manage their pain from this poor diagnosis from a personal trainer, which then contributes to a poor outcome. And that's probably the most disheartening, but also most common referral that I see, or misreferral that I see. Whereas I'm quite happy to diagnose the shoulder pain and send them straight back to the personal trainer with a management plan that the personal trainer can implement. So that's one example for me.
Yeah, awesome. That's all we're after. Nice, concise answer. And you do see it a lot of the times, particularly in S&C. You see S&Cs try and diagnose and then try and get away without seeing a physio at all. Richard?
I'm going to stay on the theme of personal trainers, Kurt, because I think, and I actually think it's one of the hardest jobs out there, because with so much overwhelm in society, so many personal trainers are being hit daily with the idea of it's a pseudo therapy session rather than a training session. And this idea of, no longer are we seeing this disconnect between training the mind and training the body. I think everything's kind of moving to blend those. And so I think this really goes back to Clint's opinion really early on in this session, which was, how do you navigate that to a point, but then also recognizing that, hey, we're here for a training session, not for a therapy session, and working out how you call that. And in my experience recently, more people are getting that wrong than right, and are probably both delving too much into psychological issues rather than referring them. And also the net effect of that is they're getting crappy workouts as well.
Yeah, it's a very good point there. You see it quite a lot, and as much as we spoke about personal trainers, they do have actually probably one of the toughest jobs, where they're considered they can take on everything, but we know that the scope of practice is actually generally limited. But that's currently where we sit. Peta?
2, supplements. S&C's deciding that it is safe to say, I think you should all go on creatine, or yes, you can start creatine, or yes, you should take a pre-workout, with actually not understanding the role. And I've seen severe injuries in young athletes with that. So that's definitely one that I see. And sorry, I've just lost my train of thought because I can hear my baby crying. And the other one is body composition. It really grinds me. And this can be coaches, and it can be strength and conditioners, or it can be PTs, especially with women, saying you need to be leaner, or you need to be heavier, or you need to be, without knowing their body composition history, where they're understanding the numbers first and foremost, their training history. Like, it's actually very complicated and should never just have numbers thrown out. And having numbers thrown out at athletes really messes with their mental health. And then I have to then pick up the pieces over weeks and months, trying to rectify numbers that S&Cs and coaches have no knowledge or understanding of, thrown at athletes. So that's a big one for me that causes a lot of damage. And then especially in team environments, when I don't have the support of a psych to then, I suppose, work our way through that. But that happens way too often for me.
Yeah, awesome. Well, not awesome to hear that happens, but awesome to have that kind of clarification on a few things. Nick?
Yeah, as the S&C industry, I would say many do try and pretend they are nutritionists or dietitians. And I think I was actually having this conversation with my manager this morning about how the ASCA level 2 back in the day was very nutrition focused when it should not have been. And it has been changed, which is really good to see. But in terms of who jumps into S&C lane, I've just given physios a rap, and I love physios, but physios often are the ones who will try and prescribe. And I know there is a lot of physios out there who are starting to look at S&C and wanting to come into an S&C role. So it does end up, they do end up sometimes coming in and prescribing, which isn't necessarily the role, but it should be that blended approach where, say, they can't do whatever movement pattern, or they should avoid excess range or whatever, and then discuss program together rather than separately.
That's an awesome point, Nick. I'm seeing heaps more physios doing their like level 1 and level 2 strength
And masters
ASCA
in
course,
high performance as well.
and masters in high performance sport. I think with the goal of being like a high performance manager type position. But I'd be interested. It's probably another topic, but you know,
Another
like
conversation.
it probably is. But that's becoming more common
Definitely.
for sure.
Yeah, nice short points, Nick. And I'll be honest, I've seen a lot of S&Cs trying to go the physio route as well. They because they get into rehab a lot, so they end up going into a physio degree to do a similar thing the other way around. Clint?
Yeah, look, I'm going to agree with Nick, but I guess, you know, being an S&C, I have to also say that most of the time I see S&Cs try and do everything, especially when we're in a role like, so, you know, I do a lot of semi-professional sports, so I kind of have to pick up the slack of a whole bunch of little bits every now and then, right? So it's not just who crosses over, but the number of times that I've seen especially in the rehab space, you know, so return to play stuff, you know, and I'm sure Cam would vouch for this, you know, there's you know, return to play protocols, let's say for an ACL reconstruction or a shoulder reco, whatever the case may be, that an S&C can follow perfectly, but the number of times that I see that crossover where the physio might want to take them through that whole process to get through it. Look, it's not necessarily a bad thing. And in one team, the role will be different to the next team. And I think that's the other thing to be really clear on here is that
Super important point.
Correct, right? Like, because for me, you know, I've had roles where it's been S&C and rehab combined. And then I've had roles where it's just been a straight strength coach. So there's definitely, you know, a balance there to make sure that you get your role right so you can stay in your lane. But making sure you understand that, you know, the 6 of us sitting down together to have a discussion about one athlete, you know, that's the end game here, is to make sure that we're trying to get that person as the one that we want, you know, to progress and whatever else. So I would definitely say physios are the ones that cross into my lane the most regularly, but that's also a good thing. And I've learned some really excellent, you know, I guess, conflict resolution strategies, if I can put that in a polite term, because apparently you're not supposed to punch people in the face, and that's not the best way to get the outcome. So I think, you know, you have to remember that it really is about a collaborative approach and being aware of what your role is and making sure that you know how best to manage that situation between physio and S&C, nutritionist and S&C. So yeah.
So one thing that's maybe not the question you asked, but I think it's important when we think about injury and return to play, which is a thing that often gets missed, is the psychological component of return to play. Where I'm not convinced it's always that physios or S&Cs delve into that stuff, but it's potentially a gap in the way that we rehabilitate people. So it's that sense of, this athlete physically capable of doing the sport? Maybe. Are they mentally capable, or are they ready? That's potentially a different question that needs to be considered as well.
I think that's super important. And I think
Absolutely.
the biggest challenge with that is often the young professionals, and also working in amateur sport that don't even think about psychology, which is a real issue. I know at Sydney Uni and now at HPSNZ, I have access to psychologists, which is the best. So anytime any of my athletes at Sydney Uni were injured, first thing I do after they told me they've actually gone to a physio would be, okay, can you book in to see the psych? They're like, oh, but I'm okay. I'm like, nah, it's still worth it to have that evaluation, to have a chat, and just have someone outside the specific team to have a look and have a chat to, just to get that plan in place and to make sure that things don't hit breaking point at any time.
And Nick, would you agree there in the sense that, you know, that's where the athlete having the trust in you means that they can then you can refer out, right? Like, because I would certainly take the opinion and the approach that the more trust that athlete has in me, it's so easy for me to guide that athlete towards a Richard, towards a Cam, towards a Pete, whoever it happens to be, because they go, you do have my best interests at heart. I understand that that's a great way for them to move forward and move out of that particular injury, if that's the case in, you know, like Richard's trying to make here. Because the number of times, you know, that I've had an athlete pass all of the physiological markers, you know, and the strength markers for return to play, and they still come back to me and go, I'm not ready, I'm this, I'm that, blah, blah, blah. So I think it's really important to understand that, you know, we are talking about staying in your own lane here, but, you know, really, you know, it comes down to, we talked about it 100 times so far today, when the athlete has that trust in you and the coach potentially has the trust in you to make sure that you can guide that athlete, you know, they are the reason we're doing what we're doing here, you know. So great point, Richard. And again, Nick, you know, I think that was a tremendous explanation there, and thank you for that. I think it's really cool.
I also think in general, as sports professionals, we do need to utilize psych. It is something that I think is often forgotten, and it shouldn't be. It's so important. And like Peter said earlier on, it's often the men's pro sport that do forget about it. They don't take, it was the old, just get on with it. You're a male, you're tough. And I think that I've seen some really impressive things. I know an ex-athlete of mine, Jack, runs the Banksia project in Sydney, and Sydney Uni have recently taken on with their rugby team, getting in people to help them work on their mental health as an entire team. So they're not it eliminates any potential toxic environments and any challenges, and it gives guys in particular a safe space to talk, which often didn't happen and is and can be a real issue around having all men as the support staff and all men as the coaches and all men's teams. Is it does create that toxic environment where mental health is not addressed, and that's when psych becomes even more essential.
Yeah, and look, Richard brought it up before, the mental health first aid course, you know, or the mental health response course. And look, I mean, that's why I became involved in a mental health organisation called RISE. They teach those courses, and I think, you know, we've just got the tick of approval from Fitness Australia that mental health first aid course is now worth 5 CEC points ongoing for all personal trainers. Now, I know that that's not the combined total of this topic, but I certainly understand that some of the participants on today's call would certainly be personal trainers, and it's just tremendous to have that little niche in you know, that understanding of that, because it also certainly talks heavily about understanding that this does not make you a psych. What this does is that this allows you to see some little signs that know that they might be the little red flags to refer out to a Richard, to a psychiatrist, or whatever the case may be. So again, you know, Nick, great point, and thank you, Richard, for bringing up the mental health first aid course earlier as well.
Yeah, and all great points, and we could probably talk about this topic for another few hours, bringing up all the other little extra things and how to work and navigate around our specific industries the best as we can. But just to keep this short, we'll come to a final question. I know that, like I said, there's a lot more we can cover, but and we're going to start with Cam again. Is what advice would you have for coaches or professionals around staying in your lane? Just some parting advice. So we'll start with Cam.
Good question. It's been tough going first with all these questions, but I'll take it on. What advice would I give to young professionals? I think just don't be scared to ask for help, and it's not a sign of weakness at all. And you often, like it's been said in the call, you often learn more and develop yourself faster by involving other health professionals, and it's not a sign of weakness. It's just a sign of caring, and also just knowing your specific skill set.
Brilliant advice, Cam. Brilliant. Richard.
I'm not convinced this is going to answer your question, but it's an important point, I think. So I'm going to say this anyway, and then we'll try and manufacture it into the question later, which is, look, I think as a kind of a starting point, we all see a problem or an issue with an athlete or a person through the lens of our own experience, from whatever professional starting point and the education pathway we've been through. So initially, we'll see things from that, and so I think, you know, we talk about this as about staying in your lane or, you know, scope of practice. I think there's a broader question here, which is a diversity question, a diversity of opinion. And I think, yeah, it's knowing that we all come at problems from our own lens means that in order to get effective solutions, we need to value both our own experience and where we come from. There's a power in that, but also recognize that it's always going to be insufficient. So we've always got to involve people from other professions to get a better quality decision. So I think we need to stay in our lane, but stay in our lane does not mean excluding or not talking to other professions. If we only stay in our lane and we don't involve and talk to other people and we just put the blinkers on, then it will be ineffective. So I think we've got to do both of those things.
I think that's actually answered the question perfectly, Richard. I think that's amazing answer.
Yeah, Cam, you might have
Peta?
to go first, but I've got to go after Richard. So, you know. I think just two really quick things. I think coaches are often put in those roles having not worked in a high performance environment. So I'd love to see a course that actually upskills coaches on the different staff and their roles that could help them. I don't think coaches actually understand. We have a good knowledge of what we all bring to the table, but I don't believe coaches do. And then the other thing is just not believing that, saying, I don't know the answer, but I do know someone who will be able to help me out, or I can find the answer from Peter or from Richard, actually makes you look more professional, not less. And I don't think that message is getting through, and I'm really sorry, I'm breastfeeding, so I'm going to mute.
That's okay. But I think it's also a very valid point there. So great advice. Nick?
Firstly, women just can do everything. Peter, legend. So for me, two main points is firstly understanding what scope of practice is and what your profession actually and your qualifications actually mean you can do. So a common misconception, and I'm going to pick on personal training because I know what they are allowed to do. Working without having upskilled just your typical personal training course, it doesn't mean you can work with anyone with any health disorders, any injuries. You can work with general pop only, as if you've only done, say, your Cert 3, Cert 4. Just like S&C means you can't actually be a dietitian or a psychologist or a physio. So that's my first point. My second point would be go spend some time with the other disciplines. Obviously, there are challenges, like you're not going to be able to spend some time when psych's got clients in, for example, but spend some time with them. Take them to coffee, ask them about their roles, learn about the other professions, and how you'll understand better how they all integrate, and then better how you fit in and how you can progress what you're doing to further the athlete's performance.
Super great points. I think that's one of the biggest ones is just taking someone to coffee. So that was my first relationship with a dietitian. She was a great dietitian. Sally, which I think she's changed her last name a couple of times now from Apple to Zucchini Nutrition. We actually ended up having a 45-minute chat just about the industry. And then I said, oh, sorry, we're meant to talk about business. And she goes, that's all right. We've got what we need. So I think it's a great point. Clint?
So I've written a couple of things down that I just wanted to make sure that I got out. So the first one, and I wrote this before we started today, to make sure that I said somewhere through today, which was get a great network and trust the process of what those people do. You know, I've met, I couldn't tell you how many physios over the years. I've spoken at physio conferences. I've spoken at chiropractic conferences. I've got, you know, a tremendous network of people. And if I have an athlete, and especially now working with motocross, especially, so do a lot of work with the Red Bull riders. And what that means is I've got 2 in Perth, 2 in France, 2 in Sydney, a couple outside of Greater Sydney. And so I've got to have a physio available for every one of them. I've got to have, you know, different people available for each part of that process. So I've got to trust the people in my area, but I've done a lot of work to make sure that network is there. So a bit of advice to everyone who's listening or watching today, please make sure that you try and get to know some good physios in your local area and your extended area. Obviously, we can't do a great deal of travel at the moment, so this is a great opportunity to actually build that network and build that group of people. And I also wrote this, which is stay in your lane, but keep the windows open so you can hear the people in the other vehicles. So I guess I'm just trying to give people a little analogy of, you know, if you're driving down the road with your windows up, you don't get to hear what's going on in the lanes beside you. So, you know, that's kind of the 2 points that I wanted to sort of make sure that I got out in relation to that, because I think it's really important, you know, and most of the people on this call I've got some kind of relationship with outside of here, because either I've reached out to them or they've reached out to me, and referral in that particular pathway. So I think it's really cool. And Nick will remember this. Ashley Jones was at Sydney Uni early last year, and he spoke about the fact that he spends more time with the allied health professionals in the teams that he works with than he does with the players prior to pre-season, to make sure he's built that group of people really solidly. He knows potentially what the physio might say in relation to a calf injury, what the dietitian might say in relation to the use of creatine, like Pete talked about. Now, that's not because he wants to refer and wants to be, you know, to take their role. It's because he actually knows what he doesn't know. So he wants to understand each of their opinions. And I think that's super important. And you know, for anyone out there that's in that space, make sure that you know the role of the other people around you, so you can make sure that you get a really, really good outcome when it comes to that.
Brilliant, and I love the analogy. So thank you everyone for joining today. I think it's been great. We've got a few things which we could easily make into other webinars, but we'll keep it at that for today. So again, thanks for taking the time out to chat. This will be up on YouTube at some point. I'll send everybody the link to this as well. So thanks for joining, and enjoy your Friday afternoon and your weekend.